Hello, my name is Susan Leigh, and I'm one of the founding members of the National Coalition for Cancer Survivorship when we started the organization back in 1986. Today, I've been asked to talk about oncology nursing and the importance of our oncology nurses in survivorship and the care of our cancer patients and cancer survivors. So this is in honor too of the nurses as we celebrate National Nurses Day and National Nurses Week. So let me start by talking a little bit about the semantics of survivorship, because I think that makes a difference in how we look at our oncology nurses. When NCCS initially started, we looked and defined survivorship as a continuum, that survivorship starts the moment you're diagnosed, and now some people are saying it starts before the diagnosis, especially for our pre-survivors who have increased risk of developing cancer but may have not been diagnosed yet. And then through diagnosis and treatment and into post-treatment survival. So survivorship to us was a continuum that we go through different stages. And Dr. Fitzhugh Mullen actually defined these stages as acute, extended, and permanent. Then the medical community finally got on board to take a look at long-term survivors and people who have left treatment and what happens to us afterwards. And they've defined survivorship as a specific stage of survival that begins when treatment ends. And it's mainly for people who are potentially cured of their disease. And what we feel at NCCS is that this leaves out a whole continuum of people. It leaves out people who may never finish their treatment. It leaves out people with metastatic disease. It leaves out people who are at end of life. And so when we take a look at survivorship as a continuum, starting in the very beginning and continuing through the end of life versus a very specific stage of survival, then we can take a look at the roles that our oncology nurses play. So I just kind of wanted to explain that a bit. So as I was thinking about oncology nurses and the roles that they have in our care, I came up with quite a list of different ways that oncology nurses can be involved in our care. And I know I've left a lot of different roles out of this now because oncology nursing is getting much more complex. And as the complexity of medicine increases, so does the role of the oncology nurses. But when we first think of oncology nurses, I think everybody thinks of the nurses who give chemotherapy. And certainly that's probably the biggest role in oncology nursing now, is the nurse in the clinic or in the hospital who's actually giving us our therapies, our chemotherapies, all of our drugs. But there are also nurses that we see in the hospital who may be on a ward that just takes care of oncology patients. Those certainly are some of the first line oncology nurses we see. We also then see our oncology nurses as interpreters of all of the information that our doctors are giving to us in kind of a big, massive amount of information that many of us can't absorb when we first hear this, and we're so nervous and anxious about the information we're hearing. So our oncology nurses interpret that information. They reinforce the information that the physicians have given us and make sure that we understand what's going on. Then there are the educators. All of our oncology nurses are educators, and they educate us not only about our therapy, but then about the resources that we have in our clinics and hospitals and communities, our social media, and that education then continues throughout our treatment process. They support us. They support us not only through the anxious times and difficult times of getting therapies, but they also support our family members and loved ones, as they're very often as involved in all of this as the cancer patient is. They're connectors. They connect different physicians and other providers with each other so that we get a continuum of care that's as smooth as possible. We now have lots of nurse navigators, oncology nurses who have gone an extra step to become a navigator, which is a specialty area to help us really get through this process and find the type of support and resources that we need. And then they're program developers, and very often the navigators do this too. They're developing programs for us. They're developing support groups, especially when we don't have social workers available. They're developing educational programs where dietitians come in and talk to us, psychotherapists come in and talk to us. We get the different kinds of support that's needed. They're researchers. Now, I started my career as an oncology nurse being a clinical nurse researcher, but this was years ago when the nurses, we did the research in the area of clinical trials. We collected the data, we navigated the patient through the clinical trial process. But today there are nurse researchers who actually have their doctorates. They have their doctorates in nursing research, and they're coming up with some of the best research in the area of survivorship that we have now available in our journals and programs. And then I think one area where oncology nurses have become critically important is in the area of nurse practitioners who are developing and running our long-term follow-up survivor clinics. There are never enough of them to go around. And sometimes, people are just frantic for getting information about what we do once we go off therapy. And hopefully more and more of these nurse practitioners will be available to help us with a very difficult time of going off therapy and hopefully becoming longer term survivors. So these are just some of the few areas that oncology nurses are helping us along our continuum of survivorship. And I take a look at this as a lifeline. Lifeline comes to mind to me because they really are a lifeline in many respects of oncology care. So one of the things that I can ask our oncology nurses to do, one of the critical areas that they are so important to help us, is to prepare us to finish our initial treatment, to go off therapies, or to continue on with maintenance therapies, or whatever our path is going to be after that initial course of treatment. Help prepare us, and hopefully they can help prepare survivorship care plans so that we have a roadmap as to what may in fact be our life in the ensuing weeks, months, and hopefully years after we complete treatment. So kudos to our oncology nurses, and I wish them all well, and I'm so proud to be amongst them myself. Thank you.